Hello, everybody, and welcome back to the Rupa Subramanya Show. As always, it's great to have you here, and thank you so much again for taking the time out of your busy schedule to tune in. Today, we're returning to a topic that many of us wish would just go away. But unfortunately, the powers that be and the doomsaying experts that whisper into their ears and also shout from the rooftops of Twitter mean that fresh pandemic restrictions like masking mandates, at least here in Canada, seem to be back in discussion. Canada just seems to have a really hard time moving away from the pandemic, and I wonder why. Many jurisdictions, for example, here in Ontario, both at the provincial and municipal levels, are strongly encouraging mask use. And you know what happens when there's a strong recommendation? After a while, if people don't do as they're ordered by the government, even if it defies all common sense or scientific evidence, it turns into a mandate. In Ottawa, for example, the school board is actually considering mandating mask use in schools, which defies the scientific evidence out there, which tells us that it would be really bad for children. My guest today has been at the forefront of challenging this official doomsaying narrative around COVID right from the get-go, right from the beginning of the pandemic. Dr. J. Bhattacharya is a professor of medicine at Stanford University and one of the architects of the Great Barrington Declaration, which is about calling for a sensible and measured approach to the pandemic rather than just mindlessly locking us all down with restrictions, which ends up causing more harm than good. And we now know that these restrictions and the lockdowns actually ended up hurting society more than they ended up helping us. Dr. Bhattacharya, by being at the forefront of this rational and sensible approach to COVID, has had to face the usual criticisms by those promoting groupthink, that he's spreading misinformation. But he's withstood all of these criticisms, and he keeps fighting the good fight. It's my great pleasure to welcome Dr. Bhattacharya to the show. So it's great to have you on the show, Jay. I'm so glad we could finally make this happen. I'm sure it's a lot warmer in California where you are than here in Ottawa. So Jay, I first discovered you way back at the beginning of the pandemic. I would say as early as March 2020, when you wrote this very influential and powerful op-ed in the Wall Street Journal, co-authored by Aaron Ben-David. There you made this very important argument that COVID deaths are likely highly exaggerated, essentially because the calculation uses the wrong denominator. The true fatality rate is the percentage of people infected who died, not the percentage of identified positive cases. And this is because of selection bias of those who had been tested. So what was great about this op-ed is that it made a very important point, a very important argument using statistical concepts that could be understood by the layperson. Looking back at that time, you and your co-author were probably among the very first to challenge an emerging consensus or emerging orthodoxy, which quickly hardened into orthodoxy. What was your motivation at that time? Did you ever think that the world would lose 2 or more years of the pandemic in the way that it did?
I mean, I was in many ways naive at that time. The thing that motivated me to write that piece, in part, the most prominent thing was it was a scientific hypothesis.
Right.
Actually, if you read the piece carefully, we're very clear that we don't know the mortality rate. We called for a study, measure and basically it was a seroprevalence study to measure the prevalence of the disease in the population at large, which we were pretty sure was going to be much more than the number of people that had been identified as cases, but we didn't know how much. And so that's why that was the purpose, was to call for a study to test a scientific hypothesis. But I was also in the back of my head, I'm a health policy person, health economist, as well as an epidemiologist, and to me, the lockdown policy that we followed, it was so clear and obvious it was going to cause damage to the poor, the working class, to children, to vulnerable people, that we displaced all of our other priorities in life with this one priority, avoiding COVID. Well, all those other priorities, many of them are vital to health and well-being, as we've learned.
Yeah, no, absolutely. In fact, I used your op-ed in a piece that I wrote. I wrote a series of articles back in March of 2020, and I was stuck in India at that time. And as you know, India enforced one of the harshest lockdowns in the world at that time. Imagine locking down 1.1 billion people. Yet they did that, and I was making the case that India shouldn't do that. And in exactly saying what you just said, which is, you're locking down the vast majority of the people who are poor, but yet voices like mine were just dismissed as being as that we weren't taking the pandemic seriously, and look at all of the people who are dying in Italy and so on and so forth. How did you, I mean, speaking of lockdowns, you've argued in various fora that lockdowns were a mistake. Why do you think they were a mistake? What was the risk benefit calculation that was going through your head when you realized that lockdowns were doing more harm than good? And likewise, you've also opposed vaccine mandates. And again, I'm wondering why you thought that these measures were doing more harm than good.
So let's take the lockdowns, and you mentioned India, so let's talk about that.
Yeah.
The lockdowns in India, right? So
Yeah.
When Prime Minister Modi imposed the lockdown,
Mm-hmm.
I mean, it was, as you said, one of the most draconian in the world. He ordered like 500 million migrant workers to go back to their home villages, right? So they work in Mumbai or somewhere. They sell coconuts on the street. Their entire life savings is in the coconuts that they bought.
Right.
If they sell the coconuts for the day, then they can buy coconuts the next day and then feed their family. Well, the lockdown meant they had no one to sell the coconuts to. Now they're utterly impoverished. Now they have to go back sometimes 100, 200, 3,000 miles, 1,000 miles away, back to their home village. There's no capacity in the Indian transportation system to transport 500 million people overnight. And so a 500 million people walked. Some of them walked, some of them rode their bike, overcrowded trains or buses or whatever they could manage to get back home. 1,000 died that day en route to home. 1,000 immediately. Just in that one order. The cruelty of it is almost unimaginable. There was a friend of mine that did a seroprevalence study, measure of antibodies in the population in Mumbai in July of 2020. And what he found was that there was a deep divide in if you go to the Mumbai slums, like the Dharavi slums in Mumbai, what you saw was 70% prevalence of the disease by July 2020. During the lockdown, outside of the slums, it's like 20%. There was this deep inequality in the ability for poor people, to comply with the lockdown orders. Lockdown means death for the poor. That's in the developing world. In the developed world, there's this deep social inequality that characterizes how lockdowns were actually experienced, right? So if you look at the data out of Toronto from early in the pandemic, what you see is the 30 richest neighborhoods during the lockdown have a huge spread of the disease. I'm sorry, the 30 poorest neighborhoods have a huge spread of the disease, whereas the 30 richest neighborhoods, almost no spread in the first few weeks of the lockdown. The ability to comply with lockdowns depends on your social position, your income, your status, the kind of job you have. Only a small fraction of the world's population can abide a lockdown. That was running through my head in the beginning. And for closing schools, I mean, that's going to have lifelong negative consequences on our children. It already has had deep negative consequences psychologically, of course, in terms of the learning loss. The reason why I say it's lifelong is that there's a literature that's from before the pandemic that measured the high returns, the incredibly high returns to investments in education. You interrupt that for a short time. What you've done then is consign those kids. Short time now is 2 years in some places, to a lifetime of lower income, more unemployment, worse health, and shorter life. That's what we've done. One estimate was from just the US alone, is 5.5 million life years taken away from our children just based on the spring school closures alone. Spring 2020 school closures alone. We basically threw away our commitments to the poor, the vulnerable, the working class overnight, in the hopes of stopping the spread of a disease that is not stoppable with any of these kinds of technologies.
So was China a template for us? Because it was China and then Italy, and then everybody else followed suit. What was the inspiration behind the lockdowns China?
I think it was actually. So it's interesting to
Yeah.
read FOIA emails, FOIA Freedom of Information Act emails
Hmm.
from communications between Tony Fauci, Francis Collins, the head of the NIH, Jeremy Farrar, who's the head of the Wellcome Trust, a big charity that funds biomedical research in the UK, and a whole host of virologists. Some of one of the focuses in early January was to get some American to go on this World Health Organization junket to China. Because if you remember back then, China had imposed this draconian lockdown in Wuhan in January 2020.
Yeah.
And so there's this Cliff Lane, who's a aide to Tony Fauci. The American government finally finagles Cliff Lane onto this junket. He goes on this junket and on the it seems like on the flight back almost, he's writing or talking with Maria Van Kerkhove, who's a high epidemiologist of high position at the World Health Organization. They write a report in February 2020 based on their observations of China. Cliff Lane writes to Tony Fauci. He writes to Maria Kerkhove. He writes, it looks like what China did worked, albeit at great cost. We have very difficult decisions to make. It's going to take more than just the people in this room to make those decisions. This is like mid-February 2020. If you remember back then, there was no talk of lockdown. In fact, there was a big pushback from the left against the flight ban from China. And when Trump opposed it, people were accusing him of racism, right? Actually, I think the flight ban was a mistake because it was already too late. The disease was already seeded, I think, in fall of 2019. And I can talk about some of the evidence for that, but the point is that certainly by February 2020, it was already all over the world. That's why the cases were you seeing in Italy back then. There was also Iran. You're seeing cases. That meant the disease was out there. It's a highly infectious respiratory disease, very clearly spread by aerosols. That's the only way you get those big super spreader events that we saw in the early days. So you just had this like situation where everyone in the West is looking to the Chinese model, thinking that the Chinese model had worked. They're looking at Italy saying, oh gosh, they didn't shut down early enough. That's why it didn't work. They weren't draconian enough. That's why it didn't work. Let's adopt the Chinese model. We can make the disease go away. We'll be heroes. That Chinese model had a tremendous impact on the Western epidemiological thinking and on Western public health thinking.
Yeah. Looking back at that time, one of the puzzles I had then, and this was, when I was writing these pieces sitting in India, I remember the news coming out of Italy was horrific. Almost every day there were like 700-800 deaths. And I remember, people were freaking out on social media. This is happening in Italy. It's a country in the West. It has a fairly good healthcare system. If this can happen in Italy, just think about, what this could mean for the rest of us. So what happened in Italy? Why, looking back at that time, why was it so bad in Italy? Or was that normal given Italy's demographic profile?
I mean, a few things happened. So one, Italy is certainly older. So you would expect there to be much more severe disease from this disease. So I think that's certainly part of it. The demographics were very important there.
Yeah.
The Italian healthcare system is stressed at baseline every respiratory virus season. That's a normal thing. Of course, it was stressed much more here. Part of it is also, and you saw this in China, the doctors themselves were scared to treat the patients. They were doing these ventilator protocols in part, I think, to protect themselves. Because if you're on a ventilator, maybe there's less virus particles being spread outside because it goes in the machine or something. I mean, I don't know. I'm not sure exactly what they were thinking. The key thing though is that like you saw those coffins.
Exactly.
With all these people like lined up in coffins, they couldn't get family members to come and pick them up because they were scared. The fear itself, I think, drove itself. It's like a self-fulfilling prophecy, a cycle. right? So people were scared, doctors were scared. They acted in ways that furthered the panic, and they were looking for any guru to solve the problem. And they just thought, okay, well, this if we just locked down like China did, we would have avoided this. The thing that would have avoided this would have been focused protection of vulnerable people, older people, right? If people had looked at the data out of China and the Diamond Princess and realized, look, there's this enormous age gradient. The people who are most at risk of being hospitalized and dying are older people. Still 80% of the deaths, I think, worldwide are over 65. If we had adopted policies then to protect older people, not sending COVID-infected patients back to nursing homes, for instance, then we would have avoided a lot of the death and harm that happened in the early days of the pandemic. And I think a lot of that was like, it's just panic. Like, we made these panic decisions, assuming that we were doing good, when in fact we ended up doing, very, very bad things that harm people.
Yeah.
If we'd had the goal of focused protection of older people, protection of vulnerable people, instead of protection of hospital systems, we would never have sent COVID-infected patients back to nursing homes. That problem was caused by a lack of understanding of the epidemiology of this disease and who was most at risk.
Yeah, you kind of touched upon the Great Barrington Declaration. We'll get to that in a bit. But just a question before that, with so many screw-ups by governments around the world, who, in your opinion, got it right? Which places got it right? Well, almost everyone else was getting it wrong. And what exactly did they get right?
Well, Rupa, I don't think there's any place that got it all completely right. That's not. It's just, it was not possible in the fog of war.
Okay.
But I do think that some places were better than others. Like, so for instance, let's take Sweden, because that's the most probably most prominent example of a country that followed a very different policy. I think in the early days of the pandemic, the Swedish Stockholm public health actually made huge errors. They sent COVID-infected patients back to their nursing homes, causing tremendous deaths in those locations. But very early on, they corrected themselves. Anders Tegnell, the head of Swedish Public Health, made a decision to follow the old pandemic plan, which is protection of the vulnerable. Don't spread panic. Try to calm the population down. And that's what he did. So, like, for instance, they didn't close schools because the kids were not at risk, and a data out of Iceland was suggesting that kids were not particularly efficient spreaders of this disease. So you had and on the other hand, they tried to, after that horrible mistake in Stockholm, they tried to advise older people, that this actually is a high risk disease for them. They organized communities to provide support for older people living in the community so they could reduce the amount of exposures they had. They actually did recommend limitations in mass gatherings, which are completely reasonable when the disease is spreading. But it was a voluntary kind of effort to try to, and the reason why I could do this is because they built trust with the population. The population trusted Swedish public health because Swedish public health never lied to their population. And as a consequence, they could make these measures that actually turned out to be quite effective. The overall excess mortality in Sweden is actually pretty low, on par with the other Scandinavian countries and below much of the rest of Europe. Certainly much lower than the United States.
Yeah. Which is a remarkable thing to say, because the Swedish model was derided right from the get-go. And those of us who said, hey, look at what Sweden is doing, maybe we could learn a thing or two from them, were just, once again dismissed. But coming to the Great Barrington Declaration, you are one of the architects of the Great Barrington Declaration, which called for a sensible and measured approach when responding to the pandemic, rather than using these blunt instruments of lockdowns. You were naturally criticized heavily at that time, but now it seems that many governments have quietly pivoted to your approach, the approach that you and your colleagues advocated. Maybe even China, belatedly, perhaps realizing the folly of their zero COVID policy. What was the motivation behind the declaration, and do you believe that it had the desired effect on the discourse that you all were hoping for?
So my main motivation to write the declaration was to tell the public that there actually was a scientific debate the up to that point, it seemed like to me from the public discourse that people thought that the lockdown, the pro-lockdown position was unanimous among scientists, and that only fringe, like a few fringe characters were opposed to it. When in fact, I knew that many prominent, reasonable scientists had deep discomfort with the lockdown-focused policy we followed. So the purpose was to tell the public that there was this scientific discussion going on, and to shatter any illusion that there may be a consensus around this. There wasn't one. You asked about if it had the desired impact. I have to say, unfortunately, no. What happened, turns out, a few days after we wrote that declaration, Francis Collins, the head of the National Institute of Health, wrote an email to Tony Fauci calling me, Sunetra Gupta, she's one of the fantastic epidemiologists at Oxford University, and Martin Kulldorff, who's then at Harvard University. He called us fringe epidemiologists. I guess let's see if I can find it. A friend of mine sent me a card that he made up for me that says fringe epidemiology on it, with my name on it. So, anyways, and then he called for a devastating takedown of the premises of the declaration. I started then getting calls from reporters at like the New York Times and Washington Post, in effect asking me why I wanted to kill grandma, when in fact what the declaration said was protect vulnerable older people. That was the central idea of the declaration. What I really hope would happen, in addition to the public understanding that there was no illusion of consensus, I was hoping that public health would engage in a creative discussion about how to protect the vulnerable. We gave a lot of ideas in the declaration, but protection of vulnerable people is a local thing. It really depends on local living circumstances. It's going to be the right policies in Ottawa are going to be very different than the ones in Toronto, very different than the ones in downtown LA, very different than ones in Billings, Montana. It'll depend on where the older people live, their resources, the resources of the broader community, and so on. And what I was hoping is that local public health would engage in a creative thinking about how to better protect vulnerable older people. But instead, we got this demonization, smearing. People who signed the declaration, some of them lost their jobs for the act of signing it. It was really an amazing thing to watch public health decide, especially the high poobahs of public health, decide that we were so dangerous that we had to be essentially thrown out of the city walls, put under the fringe, instead of actually with creative engagement, scientific discussion, good faith scientific discussion.
Yeah, what an extremely horrific and shameful part of our history. It's just crazy, absolutely insane when you think about it now. We're now in the late fall of 2022, and the pandemic is still hanging over us like a shadow, especially when it comes to government's saber rattling about renewed restrictions, especially here in Canada, where we just refuse to move on. Where we are today, do you believe it makes any sense to reimpose masking mandates, for example, whether it is in public places or specifically in schools? And does it make sense for, on masking mandates, should they come back? Does it make sense for average healthy people to jump onto an endless round of boosters, as governments are encouraging, at least here in Canada? Basically, where are we in the pandemic right now, Jay? Can the average person just assume life is back to normal and treat COVID-19 as it's another respiratory disease of a type we've dealt with for millennia?
So first on the mask mandates, I think that the mask mandates were almost entirely useless. Entirely. Why hedge? I think they were entirely useless in actually stopping disease spread. Heavily masked countries like Japan, South Korea have seen enormous outbreaks of the disease. The mask mandates have not stopped the disease from spreading in China. The masks did not work to stop disease spread. Instead, what those mandates did is it created distrust in public health that vastly oversold their ability. And worse, it was a mechanism to moralize the disease, to divide people into good guys and bad guys. If you're wearing a mask, you're a good guy. If you're not wearing a mask, you're a bad guy, and thus divide the public. So now half the public doesn't trust public health. Half of the public hates their neighbor, the other half hates the other neighbor. You have something that public health should never do. Is public health should seek to unify the population, not divide it. The mask mandates are almost a perfect tool for division, and it was not based on any reasonable science. The randomized studies before the pandemic on the ability of masks to stop highly infectious respiratory diseases in masks used by the general public to stop those highly infectious respiratory diseases was non-existent. In fact, they found negative results. That was why in February 2020, you heard public health saying, don't use masks, because that was the consensus based on a tremendous body of evidence. Based on nothing, we switched overnight to you have to use masks, and it's the only way to stop it. The evidence developed since the pandemic shows that nothing's changed really in terms of the science. They don't really work when used by the general public. And the physics of it can explain why, right? So if you wear a mask, you don't have glasses, but I have glasses.
Fog up.
Yeah, they fog up.
Yeah.
This disease is spread by aerosols.
Yeah.
Aerosols are like they sit in the air for a long time. The fogging up is the aerosols. If I have COVID, my glasses are filled up with aerosols that have COVID. I mean, you just can't stop a disease like this with masks when it's worn by the general public in the way that normally the general public would wear it. And kids wearing masks, I mean, come on. There's literally no evidence that does any good. And there may be some harm. Like I've had lots of reports from autistic moms who wrote to me saying, look, my kid can't abide by a mask, or hearing impaired parents, or it's just you need to, if you're going to impose something like this on the general public, you have to have excellent evidence, and the evidence base was poor, and it was divisive. It's diminished, destroyed trust in public. To bring it back now makes no sense. Sorry, I got a long time about masks, but like the other part of your question is even more important, Rupa. You asked about where we are in the pandemic. The key thing is such a large fraction of the population has had COVID and recovered. It's not March 2020. Nearly everybody was at risk because no one had seen COVID before. The bodies didn't know how to cope with it. Now we're at a point where such a large fraction of the population has had it before. It's defanged the disease. It's not that you can't still die from it. There are still vulnerable people, but they're vulnerable to so many other things. They're vulnerable to other respiratory diseases, for instance. So they have to be careful no matter what. But for the vast majority of the population, it's not going to kill you. It's 10 times more, 100 times more. It's 100 times less deadly, 10 times less deadly than it was before for the vast majority. So it's a relatively minor risk relative to the other risks people face in their lives. And so to bring back all of the old things that didn't work before in the hopes that it'll work now when the benefit of them is even less than it was back then makes no sense.
Well, so despite all of this evidence that you point to about masks before the pandemic and during the course of the pandemic, why did governments then flip-flop on this? They said masks don't really do much, and then masks became the silver bullet for everything. And it's a bit like what happened with with the vaccines. The vaccines were meant to prevent transmission among other things, but then Omicron happened and everybody was getting COVID-19. So, despite all of this, we're still being told, take the vaccine because it prevents transmission, which I think would be seen as misinformation at this point, because I don't think it prevents transmission. I got it despite receiving my booster last December. So what's going on? I mean, you have all of this evidence, but public health seems to be on a different planet altogether.
Yeah, well, let's go back to masks real fast.
Yeah,
there's I said the consensus before is based on good randomized studies, but they were like I think like it's like if you ever go to a rookie doctor, a new doctor, you ask them a tough question. The doctor then faces a dilemma. The doctor doesn't know the answer to your question, but they're the doctor, so they're going to lose authority, right? If they don't give you an answer. And so everyone's looking to public health. It's March 2020. Everyone's looking to public health. What can I do to protect myself? And washing hands, yeah. But that's not enough. People are still scared. And I think public health thought of masks as something that's low cost, who cares? It won't harm anybody. We may as well just suggest it, even though the evidence base was crappy for it. I think it was this idea to give people some sense of autonomy, some sense of like control over the risk that they faced. I think it was deeply irresponsible, because some people believed them. Vulnerable people wore a mask, went out in public when they probably shouldn't have, thinking they were protected, and got the disease and died. I think that was a deeply cynical thing to do. But it was based on this like idea that public health has to give you something to do, even if the evidence base is bad. On the vaccines, the transmission, the fact that it doesn't block transmission, that was kind of known. I mean, I was looking at the data by April 2021, I suspected it, and by June 2021, I was certain that it wasn't blocking transmission, because you had these like countries that were heavily vaccinated, like Israel, that saw these huge numbers of cases.
Yeah, the Delta outbreak in Israel, despite being like 90%, 100% vaccinated.
Yeah. So what that meant then is that the vaccine mandates, which really started arriving in July, August 2021, after the vaccine rollout kind of stalled, that those vaccine mandates were based on bad reasoning. A mandate may make, I'm not sure it makes sense in this case also, but like it might make sense. It absolutely you need a vaccine that stops transmission. Why? Because if the vaccine protects me against severe disease and death, that's fine. Actually, it does. I think especially for older people. But that means I have private protection of the vaccine. It doesn't matter if you can be in my presence, and it doesn't make any difference to you whether you know that private protection. I'm not a danger to you. If, on the other hand, the vaccine stops disease transmission, if I'm vaccinated, I can't infect you. Well, in that case, it's really important that a very large fraction of the population be vaccinated, right? You can make an argument then for vaccine mandates. Although I think actually, if you have a mandate, that's a failure of public health. Public health then, because if you have a trustworthy public health says, look, this is a really good idea, people will listen to you because you trust it, then public health is doing its job. If you're forcing, then your public health authorities have failed already. Anyways, but let's leave that aside. If it doesn't stop transmission, there's no argument for the mandate. That meant that the mandates were unscientific almost as soon as they started using them. There wasn't going to stop the disease spread, and it again created this division where like you have these clean people who were vaccinated and these unclean people who are unvaccinated. And in Canada, and also in the United States, many places, essentially the unvaccinated weren't allowed to participate in civic life. In Canada, they weren't allowed to travel domestically. I mean, I think that's just a mass violation of civil rights on the basis of a misperception about or mistake about what the scientific evidence was saying, and also like I think a misunderstanding of how important civil rights are, even in the middle of a pandemic.
It's almost like we imported the caste system to the West, which is
exactly. I've had that thought, Rupa, several times. Like you can't. I mean, this is like like India struggled to try to get rid of the echoes of the caste system forever, and the West was wholesale embracing it.
Yeah. You've been very critical of the CDC and Dr. Fauci in particular. What do you think went wrong in the U.S. institutional setup? For example, does it make sense for those who decide these policies? These are also the same people who are deciding on funding the research, for example. Doesn't this give them way too much power and distort both their incentives and big pharma?
I think you've absolutely nailed it. That's exactly what the problem here is. What you had is a small group of people, a cartel, basically, of scientific bureaucrats with tremendous power to control the minds and utterances of a very large number of scientists, because they control their funding, they control their social status in effect. If you don't get NIH funding, you can't get, for instance, tenure at a major university. If you're a biomedical scientist. So you had and they use that power to create this illusion of consensus. That was a deep abuse of their power. And there was hubris at the bottom of it. They thought they knew better than everybody else what to do. Everyone was looking to them for answers, and they thought they had the answers, and they couldn't abide a debate. That would have shattered the illusion that they were omniscient.
Yeah. I mean, it's I bet something similar was happening here, but and that's certainly something that I think Canadians need to ask. I mean, that question. But Jay, recently there was this very provocative essay in The Atlantic by economist Emily Oster. She made this case for a pandemic amnesty. In other words, let's not worry about the mistakes that were made. Let's not point fingers and let's move forward. What do you make of this argument? To me, it sounds like we're letting people who made avoidable mistakes off the hook. Certainly here in the US and Canada, we shut out experts like you, who weren't singing their tune and basically only listened to those who told them what they wanted to hear, whether it was mandates or lockdowns. So what do you make of this argument? It seems like the power elites want to escape all accountability and move on without taking stock of exactly what went wrong and how things can be fixed.
I mean, I think, I have to say, in one sense, I am sympathetic, right? So, like, if your family didn't allow you to come to Christmas because you were unvaccinated or something, the only way forward is forgiveness. There has to be some, in that sense, there has to be some reconciliation of people with each other. The public health imposed this division in society on us, and as a society, as families, as friends, we have to come together to rise above that, and that's going to require some actually a tremendous amount of forgiveness to heal. I want that healing. On the other hand, I think that public health officials made huge mistakes, enormous catastrophic mistakes that damaged the lives of a tremendous number of people. You can't just forget that and move on. You have to have some kind of reckoning, and I think the right kind of reckoning is to do an honest assessment of what went wrong, the policies, the mistake, the processes that led to those policies, the lack of checks and balances, and then reform the system so that those mistakes never happen again. Ultimately, I think if you do that, lockdown will become a dirty word. People will look on the idea with absolute horror, that the same way that we look on so many vestiges of our past in horror. And I think that has to come out of an honest conversation about the tremendous errors many of our leaders made. And I'm not in favor of like criminalization. If people did criminal acts, yeah, fine. But I am very much in favor of reform, right? I think we have to, for instance, you mentioned pharma. It looks to although I've worked with the FDA for years, it looks to me like, for all the world, like the FDA has been captured by pharmaceutical interest with the vaccines. It's such a sad thing to see. The CDC has relied on absolutely shoddy science over the US CDC over and over again. Same thing with Canada. Like I've seen the same kind of problems in Canada for both for the vaccines and for the Canadian public health. The NIH has abused its power. All of these cry out for reforms. And unless we have an honest conversation, we're not going to get those reforms. So yes, forgiveness, especially at a personal level. Amnesty, only after we've had a long conversation about what went wrong and reforms happen.
Yeah. You recently said, I think on Fox News, that academic freedom is now dead. And I believe this is based in part on your experience at Stanford as someone who was critical of the establishment position. I think you even said you received death threats and possibly faced censure and felt ostracized for making an academic scientific argument. And rather than engaging in an open debate, there was an attempt to shut down the conversation. If this is happening at Stanford, one of the top universities in the world, you can bet it's happening in many other places. Do you think there's any hope of restoring academic freedom in universities? How do we go about doing this?
I think we need new leadership in universities. At Stanford, I mean, it's not so much that people disagreed with me. I mean, that's just normal in science, right? I don't have any problem with that. I've spent my career disagreeing with other people. I mean, that's just how science works. The problem is that places like Stanford have an obligation to host the debate, to host the conversation that's happening. Instead, the way that Stanford behaved during the pandemic made it essentially a hostile work environment for me, and not just for me. Basically, anyone who spoke up against the pandemic, the policies that were followed, like Scott Atlas, has reported the same thing. Johnny Anides has reported the same thing. I've gotten countless emails from junior colleagues who tell me the same thing, that they shared my opinions but dared not speak up. That's a disaster for a place like Stanford. Stanford's motto is "Let the winds of freedom blow," or "When the winds of freedom blow." That's in German, which I can't pronounce. So that's the translation. It didn't live up to that motto. It didn't live up to its high mission of promoting high quality academic discussion, especially when it's difficult. If Stanford doesn't stand for academic freedom and this kind of freedom of discussion when it's the most difficult, like it was during the pandemic, then it doesn't stand for it at all.
Yeah.
Like, that's the main purpose of our universities, is to allow that the kind of discourse, the good faith discourse that allows science to progress or society to progress. And Stanford failed at that during the pandemic.
Yeah, and so did many other institutions around the world, including here in Canada. Finally, on a personal note, Jay, looking back now, since I feel like you've basically been proved right on pretty much everything on the pandemic. Do you feel a sense of vindication that it was all worth it? If you knew in hindsight just how much heat you were going to take for challenging the establishment and groupthink view, would you have approached things differently?
If I hadn't spoken up, Rupa, during the pandemic, there was no purpose to my career. Like, I found myself in a place where, I've been doing infectious disease policy work for decades. I've done health policy work and health economics work. A lot of my research had pointed in this direction. I knew that the policies we followed were going to damage poor people, that were going to damage children. I had to speak up. I had no choice. And if I hadn't spoken up, I would have regretted it the rest of my life.
Yeah.
I do think that so many of the ideas that I was arguing for have turned out to be right, but I don't think that that's anything to do with me, really, because I was just arguing for ideas that before the pandemic would have been utterly uncontroversial. Focused protection of vulnerable people, really, people would oppose to that. Not closing schools and damaging children, really, people would oppose to that. Relying on evidence-based medicine standards for deciding, whether a vaccine works to prevent transmission. None of that should have been at all controversial, honestly. And they're all just, to me, like, obvious things. I've worked on I've written 160 papers, 107, I forget how many, I've lost count of how many peer-reviewed papers I've published in my life. And every one of them, I'm trying to say something new and different. None of what I was saying really during the pandemic struck me as new or different. Struck me as like just the normal application of what then it was stunning to me to see that so many people react so negatively to what I was saying. When if you'd just gone back 2 years, they would have said, "Yeah, that makes total sense. Why are you even bothering me with this, Jay? It's so obvious."
Yeah, amazing. It's unfortunate how things unfolded, but I really appreciate you coming on the podcast to share your insights and your thoughts, Jay. Thank you for a great conversation and for fighting the good fight. Speaking personally, my whole thinking about the pandemic changed radically when I read that Wall Street Journal op-ed back in 2020, March of 2020. And that speaks to the power of ideas and open debate in society, in a free society. So thank you for being here with me. And I sure hope I can have you back on the show again soon.
Rupa, thank you also for your bravery during the pandemic. I've admired your speaking up, but it's sometimes a great personal cost as well. I think it's one of the few blessings of the pandemic that I've got to know people like you that I otherwise probably would never have interacted with. And thank you for having me on the show.
Oh, thank you so much, Jay. Thank you. I really appreciate it, and I hope to see you.